but they are putting over. They are putting on the mouth. They are not putting on the nose.
Below the nose slightly.
Yes, just below the nose.
Yeah.
Or they just put it under the chin. Surely, this is a very, very, very serious thing. I don't know what can be done, but the people need to be enlightened. How do you put, actually it's like you're not putting a mask. Or you're just putting a mask because you want to like show people that you are putting a mask, or you like, if I come to this place, I came in a mask, you should have told me wear your mask first. But I thank God that this place you have sanitized and all that. The ignorance our people are, that is what is making this pandemic to go higher. And it's going to be a very, very serious thing, because when you go like in the market, you find people putting the mask up to the chin. The money you are touching the money and all that. You're not sanitizing. You're just, you know, kupita-pitana all over the place. This is something which, as a country, we need to think about it.
What did you say this is causing this? Is it lack of enough information? Is it our strategies of curbing COVID failing, or are there gaps we need to fill perhaps? Because it's been over 1 year since we reported our first case, and I believe the Ministry of Health actually invested quite a lot in public information awareness. What is it? Is it ignorance? Is it just getting used to the situation? How would you term this?
Majority of the Kenyans today, let me tell you, they still think that this is a myth. When we start a conversation where people are not understanding that there is corona and corona is killing, whether it's the first, second, or even you don't know whether we are going to get the fourth wave. I don't know how it's going to be. You look at places like America. I was reading the CNN. People are being caught by police because they are all over the place. They are in the parks, they are in the beaches. People are so ignorant in terms of really understanding whether there is corona or there is no corona. That is why this conversation is important, so that we can teach the public that this corona is there. And if we don't enlighten the public as a media, fourth estate, then we are not going to have it right. Because the Ministry of Health has given protocols. How many people have gone through those protocols to understand that we need to do 1, 2, 3? Even if you get a case where somebody is not, no sign is being manifested, because we find there are cases where people are getting the virus and they don't manifest anything. They are not feeling anything. They are not even coughing. They don't even feel anything. You say, you know, that person is still can infect you. This is the point you are saying. This person who has no signs and symptoms and is still infecting others, because corona is behaving funny, because there are some people who get, even on normal cases, you can get pneumonia. I get pneumonia, I don't feel anything, and it makes you feel worse.
So people react differently.
So people react differently.
Symptomatic and those who show symptoms.
Even when people are getting the jabs, the vaccines, there are some people who are blocking the nose. You feel somebody is blocked the nose. Somebody is feeling that malaise. You feel as if you got another attack of corona, but they don't. The signs are not becoming worse. Why you find another one is getting the jam and feels so sick. That is the body's, the vaccine is helping the body to build its own immune system to fight the virus. You get. But there are some people who already have immune system, which even if the virus get them, they are not manifested in any of the cases. The worst case scenario is where you have patients with diabetes, cardiac diseases, cancer. Those are the vulnerable, and the elderly, the vulnerable group. And those are the people we should think about critically to protect. Many elderly, they are just getting, because they, like I am a carrier, I go to my parents' place, I leave corona there. There's a case I was reading the other day in the newspaper. Somebody went to see their parents, and this unfortunately, this lady died, and the mother died as well. So we need to have these conversations more regularly, and also to involve the young people. The young people, they hear there is corona, but you find them hugging. Because when you go to church, like in church, you find people are hugging, people are greeting, and people are not fearing. But what are we talking about? You don't know whether I'm carrier, you don't know whether or not.
Should we perhaps relook how we pass this information, how we create awareness about COVID? If you look at how we have handled this pandemic since we reported our first case, what would you term as the hits and the misses in this particular journey? Because you're talking about very crucial issues about how people are just letting down their guard, even though they know very well that we are in the middle of a third wave. Should we perhaps relook at how we have managed the pandemic so far? Just give us a scorecard on how we have done that.
Well, I can only go to the Bible. There is this time Moses was told to make a snake of or sort of a snake, and people are told there is a disease here and the snakes are biting you. But I've told Moses to make this snake here. When you look, you don't get even when they bite you, you don't die. But there are some people who decided not to look at that snake. Some of these things we are learning even from the Bible. People are hard-hearted. People are ignorant. People don't care. We are in a generation where even if you tell them the sunshine is good, they still don't get it. So a time has come where we need to take our own responsibilities for your own health. Because, for example, like our president is so passionate about, taking care of ourselves. He makes sure some hospitals are now equipped. As medical workers, we were really agitated because we could not get the right PPEs. Even though we don't have the right PPEs, the government is trying. But we want to urge the government to try more to protect the health workers so that they are able to protect the people they come with, they get in contact. Even where we are, the studio, you are also the vulnerable group because you get so many people coming here. So those protocols, the government has given the protocols. Why people have decided not to follow the protocols, I don't know. I've lacked no words. But anyway, as health workers, we'll keep on teaching the people we come to contact with. For example, in Pumwani, we have mothers. Sometimes it's not possible for mothers to put their masks, especially when they are in labor because of pain and all that, but we keep on encouraging them. And we also keep on triaging them. You triage from the gate. Some of those mechanisms which the government has used is very, very, very crucial. And we should also take responsibility, especially the elite, for the sake of the vulnerable group, the very sick ones. Also, something before I forget. When you hear in coronavirus, you need to take the supplements of vitamin C, vitamin D, zinc. These are some of the vitamins which are vital to your body, which is helping, especially the vitamin C, is helping to build the immune system to fight this corona. So if you don't get, like you know where we get vitamin C is from the citrus fruits. So
the oranges?
The oranges, the pineapples, and all that. There's so much. If you find the levels like 0.3 grams, the vitamin C is, your vitamin C level is below, then you need to do something. And that's where supplementation comes. You find vitamin D we get from the sunshine. And many of us, like us nurses, we work at night. We don't purposefully decide to go to the sunshine and say, let me get it.
Do you have the time?
We don't even have the luxury of time.
Even
if we wanted to.
Yeah,
that's
true.
why the supplementation is very, very crucial. And we also protect even the children. Something very, very important. When we go to the public place, it doesn't matter where you're working. You could be working in a hospital, you could be working in a supermarket, you could be working in the studio. The first thing you do when you go home, you go straight to the bathroom, take a bath and leave your clothes there. You get. So that you are able to protect the people in the house. That is how corona is going through in the houses. You find many people in the house are getting sick.
Eunice, I want you to comment on something that I came across. There are quite a number of cases that were reported whereby a patient succumbed to COVID-19 and it was discovered that they had an underlying condition, a condition they didn't know they had. In Kenya, and I believe in many developing countries, that culture of going for regular checkups is still very wanting, if you may ask me. Maybe comment just a little bit about that, the need for one to go for regular medical checkups, because a majority of the population would be having underlying conditions without even them knowing they have one. So probably just comment on that.
You're right, you're right. Until you get one of your family member who is suffering from some disease, many of the people who come to the hospitals, they come because they are feeling pain. It's pain which comes.
And it's pain that they cannot tolerate.
Yes.
Because some pain,
Yes.
some level of pain,
Yes.
you're an
and
African,
you find
you can
many people, when they get sick, you get some history, you find they say that I started feeling pain, I went to the chemist, I bought blah, blah, and all that. Then the doctor goes and on and on. So we have chemists then where we have self-medication. In fact, the people are now you feel like you feeling a headache, you just go to the nearest chemist and get some headache, but you have not treated the cause. So this is one of another area which we need to have a serious conversation. Like, you all need to, if we have NHIF, honestly, there is NHIF, for example, I'm talking because I work for the government, there's NHIF where you can get some cover, or even all other covers. There are many like insurance covers people have. I have not seen a client who has just come to us or to the hospital say, I just want a checkup. Very, very, very few people.
But is it important?
It's important. Yeah. It's important. For example, the cancers which are inside the body, it's not outside the body, are painless. You don't feel anything. So until you get a symptom now, when it will be discovered when it's too late, is when now you see, oh, I should have gone for checkup. Things like mammogram for women, breast cancer is important. Cervical cancer, we have a jab for that. Yes, we have blood works. You can just go say, I'm not sick, doctor, but I need checkup.
But how many Kenyans would be able to afford that? If the same Kenyans cannot, a majority of them cannot afford getting treatment for a disease that has already been identified, how many would afford just going to hospital and saying, I'm feeling fine, but I just want to check myself and get that affirmation that everything is all right with
and
my
that's
system.
why that was
how
said.
Many would afford
that's
that?
why I said that because you have that NHIF, why don't you just use it for once? Why don't you just go and tell the doctor, I'm not sick, but I need to get checked. Let's have the reverse of doing things. Because if you wait for too late, you find yourself, even when a small cough like this, somebody can say, have you traveled? No. Have you have you got some contact with somebody who had corona? Do you work in the hospital? That's when the doctor will say, let's check for corona. And if we don't start taking care of our health, I'm not saying the people who have got sick, it's their own ignorance, but somehow, we need to start seriously thinking about ourselves. Because if I take care of myself, is when I'll be able to take care of you, my kid, my mama, my dad, and all that.
Just to get this out of the way, the NHIF, can it cater for such health assessments in a public hospital, for instance?
Yes, you can you can go. You can just say, I'm not sick, but I have come for this. It is important. God has given you time the whole year. You have not had even a common cold. But this time, I don't think even the NHIF man will say no. Because, well, it's your right. It's your right to get these services. And these services are being provided. It's only that we don't also take that first step to think, well, as you grow older, 40s, like things like mammogram. Mammogram is a checkup on the breast. Is important. Is very, very, very important. Also some blood works to check whether your vitamins C is low. When you have 0.3 grams, it means it's significantly insufficient in your body. You need to do more.
All right.
Yeah.
But then I once had, and we've had this before, especially growing up in Kenya, you'd hear people say, what you don't know will not hurt you. That the moment you go to hospital and then you're told there's a tumor somewhere, that's it. Now that's the beginning of you falling down. How true or false is this? That as long as I don't know that disease is there, I'm fine. But the moment I will realize, now that's it for me. How true or false is this? Just to clarify for people who
it is because psychologically, you know that, for example, if you have a tumor, it has been diagnosed, it's fatal, it's serious, but some of these things are preventable. And I also believe in divine intervention, because you find some of the people who are dealing with especially the malignancy, we are using these natural things. I'm not saying you disregard the other medical things, but God has given us, like, please call me, we discuss that another time. I'll be glad to share this with many people who don't know. That a tumor, it starts from a small, some few cells, and then they start magnifying. It's normal cells, but it also depends with your immune system. Yeah, your immune system becomes so crucial. That's why it's also good to eat well, to get the sunshine, plenty of water, to have a lot of oxygen coming to you. You know how you get that? Exercising. When you exercise, you get a lot of oxygen coming and a lot of carbon dioxide being exhaled. So you find a lot of toxin are not trapped in the body. So when you get, like, when you just go for checkup, those things can be detected early enough, and that they can be sorted quite early enough. Stage 1, stage 2, when it has not gone to other parts of the body, I think is the right time to get treated. We have had so many people who had these problems, and they are living okay. Let's not wait until these things are, you know, they are beating us, or you are now starting feeling pain. Even if you just walk, even without cover, you just walk to the hospital, you say, please check my blood pressure. You will be checked your blood pressure. You know whether your blood is, you know, the blood is running well. Can you check your temperature? You check your temperature. These days, even the watchmen are checking the temperatures out there. So that means there have been a little bit of training, but we need a little bit to interrogate more about which is a baseline, which is higher, which is lower, and what is a normal blood pressure. Yeah, something like that. So it will help.
This thought of what you don't know will not hurt you. We need to get away from that narrative and just go for regular checkups. The reason I ask you that question about underlying conditions is because there is a lot of talk, and all of us have heard this by now, that people with underlying condition are more at risk and more vulnerable compared to those who do not have underlying conditions. Maybe you can explain why this is so.
Again, as I said, when you have a condition like cancer, is a long-term illness, you find most of the immune system goes very low. And when your immune system goes very low, then your body is not able to fight any other invading microorganism, either virus or bacteria. So when your immune is low, then you are vulnerable. And that's why, again, you see something like cases like HIV. HIV is not really a disease, but your immune system has gone too low. You can even be killed by even a pneumonia, which pneumonia is treatable. And that's what the virus is also doing right now, and all other invading microorganisms. The body is made in a way, God is so marvelous that he makes our body so to fight its own. For example, when you eat something bad, you find yourself throwing. That tells you the body is rejecting that's what you've eaten, that's why you are throwing it. The other thing you find the body can get rid of waste is through sweat. And that's why when you go to gym, they make you do a lot of exercise and you find sweating. You get rid of those unwanted things. Another way is like diarrhea. You find people, you have eaten this and somebody has diarrhea. Also, one way of getting rid of the waste, what is not needed. And that's when you need to replace some of these things. You replace the water. You need a lot of water. When you find doctors telling you, nutrition is telling you that you need like 3 liters, 2.5 liters. You're not supposed to take that water like once you get 1 jerry can and take. You're supposed to take slowly in between portions. The meals in portions. Yeah. That's when you can beat these things. Some people have disregarded the exercising part. Exercise is very, very crucial. Even in breathing exercises, some people can jog around. It enhances a lot of oxygen in your body. Yeah. So these things are important, and the people who need this information are the young ones, so that they live knowing that exercise is not really a prescription, is a daily need. Yeah, for you and me, we need to do
a lot of exercise. Yes. I think I need to up my game on that. Anyway, Eunice, have you read any peculiar trends in terms of those who are infected or those who are testing positive in terms of the age group or the gender? Is there anything unique you're reading in terms of are children probably testing more positive or not really affected, or are the elderly? What are you seeing in terms of who is testing positives compared to the others?
Let me say the age group. When you are above 40, your body also start. The cells are growing older. For me, that's a vulnerable from 40. But Corona right now, you see, we need to have a survey to, especially the kids. The kids are not really so much infected. I have not gotten the statistics of the children versus the adults. Yeah. But adults with an underlying condition, those are the people we really need to take care of. The people who have diabetes, blood pressure, cancer, and even the age, the elderly. Those are the vulnerable group. When I read the statistic in the US, also is also the same. You find some people, even without underlying condition, this condition is weird. It's a new thing. So a lot of research need to be done so that you are able to see this group is not really getting infected, or this group is getting infected more, but all we know that the people with underlying conditions are the ones who are hit most. And those are the people we should protect. And you know, these people, they are even getting infected by the health people, because you are going to see hey, hugging and all that, disregarding those the protocols rules, which the Minister of Health has given. So we really need to protect those ones who we know that this one is having an underlying condition. We need to protect this one. But the other have not gotten an opportunity to really get the statistics, how they are going. Maybe we can check. Even the members of the public can help me to check for yourself.
Check who is increasingly becoming more affected than the others. But thanks for sharing that. I also want to know, because they've said there's no treatment for COVID. So what essentially happens when a patient tests positive and probably they're admitted in a hospital? What happens?
The first thing we do is to contact tracing. Once you get that person is having the virus, you isolate that person. When you isolate, the worst scenario is where you have to go to a hospital in isolation. Right now, we don't have isolation. The isolation places are full. The ICU beds are limited. Yes? So the only place we have is isolating yourself at home.
The home-based care.
Home-based care. And that's now where we're coming as nurses who are doing home-based nursing care. I want to salute the nurses who are doing home-based nursing care, because they are really doing a very good job.
Eunice, before we get to the home-based care, because it's part of what I wanted us to talk more about, I just want to understand essentially under the treatment part of COVID, what happens? Because many are asking, we've been told there's no medicine for treating COVID, like an identified drug that this is what will heal you from. But then what happens? Because you've tested positive, you're in hospital. What management or what happens in the hospital after a patient has tested positive?
You've said it correct. A virus, like any other virus, a virus is not even killed by even antibiotics. We all know that. But as I said earlier, when you get a case, then you go in isolation. Definitely, you'll get some antibiotics. The antibiotics will also work on the body to also fight, just try to fight, just helping the body to fight. And also you're given the vitamins I talked about earlier. You're also given that. And also it is good also to say this, when the people who are getting the natural like ginger, lemon, water, and steaming, it's really helping. It's helping. Even in hospitals, they are providing a hospital like Kenyatta University Hospital. They are helping you. They are giving you that birika. You can put your ginger and also take. It's really helping. You get that we are going back to those old remedies. The people who have disregarded the natural remedies, these are the remedies which are helping right now. Okay, you'll be given the zinc, you'll be given the vitamin D supplements, and also the antibiotics. And also that sort of isolation, so that now the body is now going to, build its own immunity. Those who are not able to go to the hospital, you can do some of those things at home, but we have quite a number of agencies. Even when you go to the hospital and you don't know any agency which is doing the home-based nursing care, you just ask. That information will be given in a general hospital, that home remedies are also helping. But you should also not go home and somebody should be checking on you. You got to have a home-based nurse or a doctor to be check on you, because some of the situation are getting worse when you stop breathing. When the breathing starts, the irritation for COVID signs, one of the cardinal sign is that cough, continuous cough. They have a very, very bad irritating cough. And when you have short coughs, you tract a lot of carbon dioxide, and also that irritating thing. It's like a dry irritating. It's so a nuisance. You find the saturations of oxygen in your body becomes low. The lungs is not able to pick a lot of oxygen.
Yeah.
So you can stay at home thinking that you are doing the home remedies without somebody checking on you. Especially the oxygen saturation, you find the condition is becoming worse. So that's why it's good to have somebody like a nurse to check on those things, even when you're at home, whether those parameters are okay, the blood pressure, the breathing, the oxygen saturations. You know, that is very, very, very crucial. How
regular or how frequent should you be checked by maybe a nurse or a health specialist while you're, doing the home-based care?
In our setup, if you don't have a nurse in the house, and there's even a dispensary around, you can also check the saturations of oxygen. Somebody is able to tell you that the saturations of oxygen are going very low, please go for medical checkup. You get. And when you're in the hospital, they check you like continuously. Those who are able to get like the monitors to check, the monitors to check the oxygen saturations, they are doing a great job, because you have that gadget. It's like a small gadget you put here in the finger. It's not very expensive. But when you buy it for the, for the home environment, it is good. It is good, because at one point you may need even a blood pressure machine, and you just get somebody, a nurse, somebody who can just interpret those records.
Figures for you.
Yeah, even if you go to a nearby clinic, you have those records. Somebody can write for you. So when they are written, you see in the morning it was like this, after 4 hours it's like this, and then after the next 4 hours it's changing, then you need a doctor to check on you. Those things are very, very important.
Eunice, now that you're talking about the home-based care, when it was initially introduced, many were a bit skeptical about it, worried about their safety, concerns about, the community mingling with those who've tested positive to COVID. Perhaps why was it important for us to begin reopening up our minds and rethinking about our isolation facilities and opening up our homes for such to be done in the home environment? What necessitated that?
I like the way the government, they came up with that strategy. Home-based nursing care is not new. Like in the US, they do it differently. Like they have the elderly. The government pays a certain home, like the nurses, so that they take care of the aged. In our setup, African setup, it's not feasible, because they feel that we should not, stay with the loved ones around. But there's one thing the people in America or developed countries have thought. When the government pays the elderly person some money to take care of himself, so you've been paid, because you are old, you've been paid some money. That elderly person is not going to the is not able to go to the supermarket. Actually, it's helping the insignificant others who are surrounding you. They are the ones who are going to benefit. But when you focus on that person and you give an environment, you take that person to an environment where she's going to get the right nutrition, the right food, the right exercise, and then the government monitors those home-based nursing cares. That's why it's quite effective. But now, coming back to our setup here in Kenya, during this COVID is when they have come up. It was there even before, but during this COVID, you find the hospitals are limited spaces. We have limited spaces. We have limited number of, for example, ICU nurses. The ones who can work with those machines, the ventilators and all that, they are limited. We have limited doctors. So the best feasible way was to get now the home-based nursing care so that patients are nursed in their own environment, which is the best thing. Because now, even in terms of economic situations, it will be much, much more. You'll only need to pay the, the healthcare worker. Instead of paying a whole bill in the hospital, you
pay for the services.
You pay
when
for the
they come.
services, and that is very, very, very good.
How practical is it if you look at even for those who live probably in informal settlements? Look at our Kenyan context, our realities on the ground. People who just survive in a single room or a small space. How realistic is this, and how is it, how can we manage, because you've said it's a very good initiative, but then looking at our realistic situation, how do we go about it?
It is a sad affair. It is very sad because you find in our setup, you find there's a homestead which has like 10 people. And this among the 10 people is one who has the coronavirus.
Yeah, true.
Now, how are we going to nurse this one and leave this one? Then it becomes now a problem because you can't even isolate this person because the setup is very limited.
Where do you get the extra room?
Where do you get the extra room for one to isolate? Yeah. So in this case, this is what we are devising, and that is my own advice. I've done home-based nursing care across the country. And I find it's important to have the home-based nursing care because you decongest the hospitals, number one. It is economically feasible, and you're able to be nursed in your own environment where you can even go outside and get some fresh air and all that. But in this situation where you find this person is sick and there's so many people, you now encourage this person to be wearing a mask because he is the one who is sick. You encourage them to wear a mask all the time so that you're not going to infect the children. And that's why now, again, it's economically this low economic situation, then you find is also a problem, but you now keep on encouraging. You can talk to the people, even in the church, to help. In this case, you find even nurses, they carry their own mask to help, they just buy to help, but if now we have the county government, if we get like these cases, we should also isolate as health workers. You isolate and report to where community self-help groups. There are those people who are helping each other in the community. If we have identified this, then people should not keep quiet. You report this case. This person is having 1, 2, 3, or this person is not really able to isolate. And that's why the contact tracing, the government is doing a good job because they are going up to where you are and they'll check whether the environment you are, whether you are able. If you are not able, then they pick you and take you to isolation centers.
Facility.
Yeah.
But how is this happening, though? Because concerns have also been raised. Some people would go to hospital, they test positive, and then they are told to just go home
and isolate themselves.
And isolate yourself. That's the best you can be told. Nobody checks whether you did that. Nobody's checking whether you went to work or not.
Yeah.
I mean,
yeah, it's a real problem which we need to start a conversation from the lawmakers. You get the lawmakers and also the protocols. The Ministry of Health has tried at some point to give the protocols on how the home-based nursing care is supposed to be done. And then make sure you also don't get people who are not qualified to do the job. If you get the right people to do the job, then you are in safer hands. Because once contact tracing is done, then my job is to report. And then this next step is for another person. If that person doesn't do their work,
even you as is jeopardized.
Even me, as a nurse, I'll feel as if I'm failing. And that's where the stress is coming, even for the caregivers. We are also in stress because if you get such a situation, and you see this protocol, this public health person, there are also few. You get, where do we go? That's why now it is important also to check what is it that I'm supposed to do as me, as a person. Who is supposed to disseminate this information to people who are not able to read and write? Who is this person who is supposed to give feedback to the government? This is the situation which is going on. Then we should have kind of, you know, a roadmap where you need help. The help should be either a phone call, because if we get digital, you have the like the doctors, the telemedicine doctors. Yeah. You can be able to get information. When you get information, then you are able to take care of the people who are living around you. But this is a serious challenge.
Yeah, we have a long way to go before we get there.
We are somewhere. We have started a journey.
Yeah, we are almost there.
The journey is long.
We are taking steps,
but we really need to do something about it.
One thing about COVID, though, it has exposed so much about our healthcare system. We have improved. There are things we've done, we've implemented, and still we have a long way to go, though. But there are quite a number of things we have done in the few months that we have been battling this pandemic that sort of are a plus for us as a country. Yeah. We'll talk about more on that, but still on the home-based care, for them who are probably exploring this or currently under home-based care, what should they do so that they prevent others from getting the virus? Let's just talk basically about what the patient should do, what the caregivers should do, just for us to understand how that context should work to ensure safety of everybody.
For the safety of everybody. In this case, what nurses do when they go for home-based nursing care, remember the home-based nursing care, we are not only talking about corona, diabetes, blood pressure. We also have there are other conditions which are, you know, which cannot be prevented, like you know, this SMA, these conditions we call spinal muscle atrophy. The babies are born without muscles, so they need that respiratory support system in their own home environment. So it's not only corona we are talking about, it's cutting across all conditions. So in this case, if you know this patient is vulnerable, it is my responsibility to go like equipped in a way that I'll be masked throughout, I'll wear gloves, I'll make sure the environment is clean. The family can also provide with things like jig to soak, you know, those things, the equipment we are going to use. Also, you know, sanitizing every now and then. Leave alone corona. I think we are going to sanitize most likely the rest of our lives.
This is the new
yes, this
normal.
is the new normal.
It's actually not the new normal, yes. It's actually the normal now.
Yeah, it's normal now, and people are getting used. So when you go to such environment where now we want to protect this sick person, we also need to take precautions as healthcare workers so that you know, you advise on diet, where you're able to advise, oh, this is the right diet, this is the right, and the medications, you know, they come with a whole load of medication. You take the medication on the right time. You need to do the exercises. You can identify other parts of the family, not necessarily that patient. You find there are other people, like in the environment, you see there are even workers. You also talk to them to understand. You also need to take care of this patient. The goal is on that patient, but in the event that other people in the family needs also to understand. You know, it's like now teaching, you do like wholesome teaching that you are taking care of this one, but even you need to eat healthy. Even you need to protect yourself. This is a kind of, well, home-based nursing care is one of the best concepts I've seen so far. It works in America, it works in other places. Even it's going to work here in Kenya, because when you go with those gadgets, they also don't see you like, the kids don't see you like, this is a doctor is coming to inject me. This is part of a family member. When you become a family member, you even get close. Even after you get, the person gets healed, you even check in sometimes, are you okay? Are you doing this? You know, those reminders are important. And you kind of bond. And if you do that, we are going to get a healthy nation free from corona. I believe and I'm convicted that it is good to take those precautions, and corona can be put in control.
I like the positivity.
Yes, I know that.
I like the positivity that you share with us this morning, because that's what many people want to hear. In this country where if you've not been infected, you have been affected by COVID. Each and every person in one way or the other, you may not have tested positive so far, but you have been affected in one way or the other. So such a positive phrase coming from you is what many people would like to hear. We are picking up this conversation right after this particular break. We are talking about the home-based care, more to come on that, and other matters, of course, that touch on how we need to better arm ourselves in this battle against COVID-19 in the country. That's our conversation this morning. This is News Check. We are taking a very short break.